Hello everyone, this is Dr. Aparna, consultant neonatologist at KIMS Cuddles, Kondapur, Hyderabad, and today we are going to discuss about an important topic, the importance of nutrition in preterm low birth weight babies. All over the world, 15 million babies are born premature or below before the completion of 37 weeks of pregnancy. And these are the babies who are at the highest risk of having poor growth and delayed developmental milestones in follow-up. Simple and evidence-based scientific strategies help preterm babies achieve equivalent growth and development as compared to their peers who are born full-term. These include 1. One has to remember that advanced respiratory care strategies such as ventilation or CPAP, that is continuous positive airway pressure, and other modes of respiratory support or breathing support do not necessarily mean that feeding should not be started. Most preterm babies who have stable blood pressures and who have stable circulatory parameters can be safely initiated on feeding with mother's own milk right from the first day. Number 2, as we discussed, early introduction, fast augmentation or rapid increase in feeding volume and trying to reach full feeds as early as possible have all been found to be safe strategies to help preterm babies achieve optimal growth and also to reduce the risk of late onset infections in this group. Third, whenever early enteral feeding is not possible for various reasons, preterm babies should be started on something called total parenteral nutrition, which is the intravenous administration of amino acids, specialized lipids, carbohydrates, trace elements, calcium, phosphorus and multivitamins, all these essential macro and micronutrients which will help them to achieve optimal growth. Fourthly, mothers should be motivated to express milk early, and this milk is found to be the best milk among all the other different options when we look at feeding for the preterm babies. Fifth, in order to achieve optimal intake of various nutrients, mother's milk should be optimally fortified with something called a human milk fortifier or a multi-component fortifier in order to provide the baby optimal levels of calories, proteins, calcium, phosphorus and all the other micronutrients that are essential to achieve optimal weight gain, optimal bone mineral density and long-term growth and neurodevelopment. With all these other strategies, it is also important to have a policy of developmentally supportive care, encouraging the early and continuous implementation of kangaroo mother care and prevention of infections in order to achieve the best outcomes in these most vulnerable group of babies. Thank you.